Hey everybody, what's up? It's Thursday, so you're with Ted on Ohio Trans Kings. It's week 6, so we're talking about therapy, hormone replacement therapy, and surgery. I did therapy. I liked it. For me, I had a lot of other non-trans related issues that I needed sorted out. A lot of anger, a lot of depression that was non-trans related that I needed to sort out before I was in a good enough place to start my transition. So for me, it was beneficial to do therapy before I started on T, before I got any type of surgery. Excuse me. Sorry, y'all, I'm sick again. So it was very beneficial for me to have therapy. I didn't have a gender specialist or anything like that. I just went to a plain old therapist, and as my feelings of transgenderism, or however you want to put it, my transsexual feelings started to surface, she did research, and I did research. And so when we met, she's like, okay, this is what I looked up as far as how we're going to get your transition started and what I can do to help you. And I, would be like, okay, cool. This is what I found too. So it was actually nice for us to both kind of be on the same page there, learning and growing and experience things together. After about roughly 9 to 10 months of therapy, my therapist wrote my referral letter for testosterone. I currently see Dr. Thomas Murphy in Cleveland for endocrinology. He prescribed my T and oversees all my blood work and whatnot. Had my first shot of T September 26, 2006. So this year will be 4 years on T for me. Hooray! Effects of T: lowered my voice. My speaking voice wasn't super high, but my singing voice was. I was a soprano in choir. I'm now a tenor and baritone, which is pretty badass. It scared me the first time, but it was pretty badass. It is pretty badass. Also, facial hair. I don't have a lot, so I don't shave it all off, simply because it's man, I've worked so hard to grow this, so I'm gonna keep it. But facial hair, chest hair, all that type of stuff. Definite changes in my body composition. I feel like my shoulders have broadened a little bit, and the curviness has gone away for the most part. Definitely built more like a biological man would be built. And in the downstairs nether regions, definite growth. I don't measure or anything like that. I think that's kind of weird and creepy. But I've tried making homemade pumps. Like, a lot of guys on YouTube have videos for how to make a pump for yourself, and so far I haven't been able to make one because I'm too big downstairs. So I guess that goes to show you that I'm pretty big compared to most people. I don't really know. But let's see what else. Oh, yeah, because I didn't naturally have high levels of T, I'm planning on being on T for a while, even after having a hysterectomy, which I totally want. I want a hysterectomy so I don't have to ever worry about having a cycle. I don't ever have to worry about any type of cancer down the road. I want to just get that taken care of, and that's actually next on my list of transition milestones, I guess you could say. So speaking of surgeries, I am post-op. I've had a top surgery. I had top surgery with Dr. Daniel Medalley out of Cleveland. on July 20th, 2009. So this year will be my big 1 year anniversary, and I'm planning on having like a little pool party or something. Should be pretty fun. And I had a bilateral double mastectomy with nipple grafts, and I would say the most painful thing was having drains coming out from under the incisions and hanging out of my arms, because it kind of prohibited how much I could use my arms after the fact. Nothing is worse than trying to reach your toothbrush and you can't. Like, all I wanted to do was brush my teeth, and I couldn't reach my goddamn toothbrush, so I had to call somebody else to do it for me. My surgery ran me $5,650 plus roughly, I think it was like $88 for my post-op binder. So that's not bad. Oh, if there's anybody out there who is getting ready to have top surgery or is planning top surgery and needs one of the post-op binders, leave me a comment and I will get in contact with you, because I still have mine. You could probably wash it. Like, it could use a washing, just because, I mean, it just could. But, they're like $75 plus shipping, and if I can give something to somebody else who needs it, that would be super awesome. Totally all about paying it forward. So yeah, sorry about that. Back on topic, surgeries. Had top surgery, want a hysterectomy. As far as bottom surgery, right now I'm perfectly fine with what I've got. If I'm going to have such an invasive surgery, I want the results to be phenomenal. I'm so jealous of trans women, because their GRS surgery is like magnificent. Like, you wouldn't even be able to tell unless you knew that, this particular person was trans just by looking at her vagina. So I am like crossing my fingers, hoping for the day that there's something available like that for trans men. Right now, the options that are there, I don't want a phalloplasty. I don't want, something that is, a high risk for infection. I don't want something that is aesthetically unpleasing. I don't want something that's not going to work properly. And as far as the metaplasty, my cock already looks like a toddler's cock. I don't need something, I don't want to have an invasive surgery that's basically just gonna, end up looking like what I already have. So I'm holding out for that, hoping that there's some scientific and medical breakthroughs as far as bottom surgery is concerned, and we shall see. Maybe we will revisit bottom surgery in the future. That's all I got. I don't know what next week's topic is. I don't have internet right now at the house, so I'm like making videos and then going somewhere to post them, or trying to get them to other people so they can post them for me. So, keep tuning in every Thursday for me, and tune in every other day of the week for everybody else. And I'm sick, so I am gonna go to bed. Have a great weekend, everybody. Peace out.